Hello viewers, today I will be demonstrating how to give knee intra-articular injection. So here we have a patient of osteoarthritis and we have planned to inject intra-articular hyaluronic acid. So I will be demonstrating how to inject it. So here I have painted and draped my patient under aseptic precautions, and we keep both the knees at 90-degree flexion. I would be injecting my drug from the lateral side. Many people prefer to use the medial side, but as per mine, there are genicular nerves on the medial aspect, so it is better if we go from the lateral side. So guys, let's see how it is done. So here what we get is a pre-filled syringe of hyaluronic acid. It has a stopper on its back which has to be removed first. So we have removed the stopper. Then the plunger, it has to be screwed inside it. So we are screwing the plunger inside it. So now our plunger is screwed. After that there is a cap on the front which has to be removed. So we are removing it, and after removing this cap there is a needle which has to be applied on its front. So now our injection is ready for injection. Let's go to the injection site. So here first we are injecting in the right knee. So here you can clearly see this is the patella, this is the inferior pole of the patella, this is the tibial tuberosity, and if we palpate along it, this is our patellar tendon. So there is a soft spot just lateral to the lateral margin of the tendon and almost 1 centimeter below the lateral pole of patella. Okay, so this is our soft spot. So from here we have to go inside and we have to keep it at 45-degree inclination and aim towards the intercondylar notch. So here I am injecting it. So I am gently go inside. It is very, just go inside, aspirate it and slowly inject the drug. Don't push it very hard. And take your time, don't be in hurry. Consistency of hyaluronic acid is slightly high, it goes slowly. So you can see I am injecting the drug, slowly it is going inside the knee joint. So here you can see I am about to finish. So my whole of the drug has been injected into the joint. I slowly withdraw the needle and we are done. So once you withdraw the needle, there is some ooze, so you always give some pressure to it, and after that you can just apply sterile dressing and the procedure is over. Now we'll proceed to the left side. Right knee. Here we are introducing our drug in the left knee also. So this hyaluronic acid, it is a viscosupplementation which is used in early stages of osteoarthritis. It acts as a natural lubricant, shock absorber, and it has been shown to slow down cartilage damage. In early stages of osteoarthritis, it can be used, and sometimes it can reduce the knee pain up to a year. Although the results are not predictable and the time duration for which the effect will last may vary from patient to patient. So once you finish the procedure, don't forget to apply an adhesive sterile dressing. It has to be kept for 24 hours at least. After that, patient it can remove and can take a shower. So guys, this is how we give an intra-articular hyaluronic acid. These landmarks which we have used for injection can also be used for aspiration. So thank you for watching.